Usually Medicare comes out with changes towards the end of the year, but this year Medicare throws a curveball, and for some of us, Medicare threw us a huge bone when it comes to GLP-1. I'm talking about the Medicare GLP-1 Bridge Program. This is what you need to understand. Bridge Program. We're going to go into who qualifies for it, how to qualify for it, and then what the next steps are to get you your, I guess, bridge opportunity starting July 1st. So let's get into that. Okay, I'm going to flash the next screen, and you're going to need to actually pick your mouth up from the bottom of your floor because your jaw will drop. Okay, $50. If you're on GLP-1, you know what I'm talking about because as it is right now, if you have a GLP-1 medication, for most companies, if you're one of the few that have gotten it under, I don't know, $600, then keep doing what you're doing by all means. But for most folks, if you are not a type 2 diabetic, your prescription drug plan isn't going to cover it. Okay, so what the bridge program is, I guess, offering, pitching, their program is $50 for your GLP-1 copay. Okay, yes, it's real. No, it's not a scam, but also no, it's not for everyone. So, what is the bridge program? Key word is bridge. This is almost like a pilot program. It is short term. It starts July 1st of this year, 2026, goes to December 31st of next year, 2027. So, who qualifies? Let's talk about that. First of all, if you're watching this video, you are in or on or around Medicare, so you must be enrolled in a Medicare Part D plan. Okay, in a Part D plan, whether it be I'll go to the next slide and tell you which way it can be Advantage, can be Supplement. Let's hold our horses. Using the GLP-1, y'all, I should have made it 72 font for weight reduction or maintaining weight. If you are a diabetic taking GLP-1, this does not apply to you. Unfortunately, sorry. For the longest time, y'all were the only ones that could get this medication. So now we're catering to the population who is, Alyssa, I'm trying to not be a diabetic by taking this medication for prevention so I can lose weight and not be diabetic. We're talking to you folk, okay? It must meet the CMS requirement, and yes, you will have a prior authorization. No one likes them, but hey, for $50 for GLP-1, we might do it, right? So those that are eligible are going to be meet those two things. Number one, we need it for weight reduction or maintaining weight, but the insurance you better have is either a standalone prescription drug plan or you have a Medicare Advantage plan, a Part C plan that has the prescription drug plan baked into it. That's also okay. If you are in a chronic special needs plan, that's a type of Medicare Advantage plan. You're eligible. EGWP, honestly, I can't tell you what it stands for, but it's going to be for those who are maybe on the teacher's retirement Medicare Advantage plan. Maybe there is a certain retiree plan that your company has offered you, and it works only by you having to join Medicare Part A and Part B, and then their plan takes over. It's got to be following the Part D guidelines. That's what that means. And then low income, that LI net, that is a program for low income individuals getting into Medicare who is not eligible. Those really, that none of these marks here, original Medicare only, TRICARE for life, and MA only, so like a Medicare Advantage plan, but without the prescription drug plan. So check your Medicare Advantage plan and PACE. So, I mean, these are programs that literally do not have a drug plan in them. So that kind of makes sense. So the question is not if Medicare will pay, the question is why is my doctor prescribing a GLP-1 medication? That is ultimately the question. So, as you can see, follow on the left side there, prescribed for type 2 diabetes, how it's handled through your current coverage, and you'll be succumb to the copays that your prescription drug, that you're probably going to hit a deductible and then you move to the copay. Look, I mean, for some plans, depending on the area, it's only 47 bucks a month. Okay, for some plans, you have a huge deductible to meet, then it turns to $11 a month. So for some, but then for some plans, it's $250 a month. So it really depends on your area, number one. And again, why is my doctor prescribing this medication? So then the client explanation that we would give, I would give the cost depends on your plan. So check your plan. Now, if you are being prescribed for weight management only, now we're getting, and the reason why it says possible is because there is a process for this. Okay. And that PA is a part of that process. We'll get into it a little bit. So, which GLP-1s? Not all of them. Not all are created equal. Okay. It's going to be Wegovy. I mean, you guys can read the screen. Wegovy, Zepbound, Foundeo. What do you think? Foundeo. It's got found in the very beginning. Foundeo. Correct me if I'm wrong. But as you can see, the method of delivery, it looks like that is going to be very particular, specifically for Zepbound. It looks like Zepbound, maybe if you're just taking it from a vial, that's not going to work. It has to be the quick bin delivery. So the process. You must talk to your doctor, and all of this cannot be done before July 1, y'all, or else it's not going to go through. It's not going to be a part of the bridge program. Must be after July 1. You'll go to your doctor. You'll probably need to know why the doctor is prescribing it to you. I know that sounds funny, but a lot of y'all take medication and you have no idea why you're taking it. No offense, I guess, it's one of those things, but it is common. The PA is the prior authorization that your doctor will have to submit. Okay. If approved, then it'll go through the pharmacy and it'll process it and then outspits your GLP-1 for $50. That easy. So the clinical criteria that we're going to be looking for, this is why you must see your doctors because you got to check these boxes, at least one of them. So number one is your BMI is 35 plus. Okay, no, nothing else needed. It just goes by the BMI. Okay. If your BMI is not 35, but it's 30, then you also must have, this is a fancy word for heart failure or anything around it. You can Google HFpEF. It's around heart failure, uncontrolled hypertension or chronic kidney disease, specifically stage 3A plus and above. So if your BMI is 30 plus, you better have those other things with it. Okay. If your BMI is less than that at 27 plus, then you must be also pre-diabetic, a previous heart attack, previous stroke, or symptomatic. Again, like this is your doctor's arena, but I'm just letting you know what they will be looking at and telling you why they are prescribing that. And then the next thing you should say, doctor, do you think I can get this under the Medicare Bridge Program? And then it's in their ballpark to see if you're in either one of these or to take measures to do that testing. So your next steps are going to be first, what coverage are you on? Are you on a prescription drug plan? Okay, step number two would be talk to your doctor. Obviously, take the steps in confirming why you are taking it. It's got to fall within those ramifications. And then you got to wait for July 1. And I should have said wait for July 1 and then go. Like it's got to be after July 1, y'all. Okay. And if you're talking with your doctor and your doctor has this deer in the headlights look, go ahead and go to cms.gov/Medicare/coverage/prescription dash. Anyways, I'll put it in the description below, but y'all, it's as easy as going to Google and typing in GLP-1 Bridge Program, and then you will get, obviously, only go to places like cms.gov to get the qualification material, print it off for your doctor, send it through your portal, and because a lot of you do the your dashboard on your app. I forget what it's called. My mother has it, but you can send communication to them as to why you're booking an appointment, send that link. You'd like to discuss with your doctor if you qualify for this program. So my point is that there's a program that is going to help so many people. I'm so glad that this program is there. Just as an agent, you think I like calling out premiums? Okay, so the first time you fill your GLP-1 is going to be $620. But then it like no one wants to pay that much. So this is going to be really cool helping out people. I think there's people wanting to do things for the right reasons. So hopefully this program is there for you. Be proactive in taking steps to doing this. The people that are more proactive about their health insurance have a better time with their health insurance and don't fall victim to it. So this is a great program. See if you qualify for it. Go to cms.gov for more information, and I'll see you in the next video.